All right, today we're tackling something, well, something a lot of people dread: kidney stones. We're going to walk through what it's like, from that first searing pain all the way to making sure it never happens again. And we're not just guessing here, we're following the map laid out by the latest medical guidelines. So let's get started right at the beginning, the moment it all kicks off. So let me ask you a question to really set the stage here. What do you think is often described as being even more painful than breaking a bone? Or even childbirth? I mean, really think about that for a second. For anyone who's actually experienced it, the answer is just instant.
Yup, a kidney stone. Now, if you've never had one, I know that might sound like a bit of an exaggeration, but if you have, I'm willing to bet you're nodding along right now. This isn't just a little ache or pain, it's your body's emergency broadcast system going off at full volume. So let's talk about that moment, when the alarm starts blaring.
So, Section 1, that unbearable flank pain. This is the moment we're talking about, when your body sounds the alarm. And believe me, it's a sudden, overwhelming crisis that can literally bring you to your knees. So, what exactly are the signs your body is screaming for help?
Okay, the signs are pretty classic, but they're brutal. First, you've got this sudden, really severe cramping pain in your side. It's not a dull ache, it comes in waves. But here's the really weird part, this intense urge to move around. With most pain, you want to lie still. Not this. You're pacing, you're shifting, you just can't get comfortable. Throw in some nausea, maybe vomiting, and feeling like you have to pee all the time, and that's the textbook kidney stone attack.
So, what in the world is causing all this chaos? Well, it's basically a tiny, hard crystal. And you can see here the vast majority, we're talking over 70%, are made of something called calcium oxalate. Just picture a tiny, sharp little piece of gravel trying to force its way through a tube the size of a drinking straw. Yeah, that's where all that insane pressure and pain comes from. All right, Section 2, the doctor's visit and the diagnosis. You've somehow made it through that first wave of pain and you're finally getting help. So what should happen next? According to the most up-to-date guidelines, let's break it down.
The process is actually surprisingly straightforward. It really boils down to 3 simple steps. First, just you telling your story. When you describe that specific kind of pain and that crazy urge to move, you're giving the doctor huge clues. Second, they'll do a quick physical exam, checking for tenderness to pinpoint the problem. And third, a simple urine test. Why? Because that tiny stone almost always causes a little bit of microscopic bleeding on its way through.
But hold on a second. Do you notice what's not on that list? In this day and age, you'd think the first thing they do is rush you off for an X-ray or a big CT scan, right? Well, the surprising answer from the new guidelines is not so fast. And this is a really big shift in medical thinking. The guideline is pretty clear. Imaging usually isn't necessary in those first few days. Why? Because the combination of your classic symptoms and that urine test is just that reliable. Right now, the number one priority isn't getting a pretty picture of the stone, it's getting your pain under control. It's about focusing on you, the patient, not just the test results.
Okay, Section 3, cackling the pain. This brings us to what you really care about in that moment, the treatment. And this is an area where, honestly, the medical advice has changed a lot based on new evidence. Job number 1, without a doubt, is getting that pain under control, fast. The guideline is super clear on this. The best first step is a powerful anti-inflammatory, something like diclofenac. And they'll often give it as an injection, not because it's fancier, but simply because it gets to work way faster to calm down all that inflammation and cramping. Okay, now let's bust a really common myth. For years, everybody was told, drink tons and tons of water, flush it out. It makes sense, right? But it turns out the evidence just isn't there. Forcing all those fluids doesn't seem to make the stone pass any faster. And get this, it can actually make the pain worse. Think about it. If you have a dam, pouring more water behind it just builds up more pressure. So the new advice is much simpler. Just drink normally. No need to overdo it.
And here's another cool evolution in treatment. It used to be just, take painkillers and wait. But now there's another tool in the toolbox called alpha blockers. These are meds that basically tell the muscle in the tube, the ureter, to just relax. The idea is that a relaxed tube gives the stone an easier path. Now, the guideline calls this a weak recommendation, which basically means it's not a slam dunk for everyone, but the evidence suggests it might help. It's definitely something to talk about with your doctor. So, on to Section 4, waiting it out. The worst of the pain is over, you're back home, but the stone is likely still in there. This is the recovery phase, the calm after the storm. Here's what you can expect. And here is probably the most reassuring thing you're going to hear. Your body has got this. The odds are overwhelmingly in your favor. There's up to a 95% chance that a stone will pass all on its own. Now, here's the timeline. Often, the stone will pass quietly in the hours or days after that initial crazy pain is gone. You'll check in with your doctor after about a week. If things are still dragging on after a month, that's when they might think about doing some imaging. But for most people, nature takes its course. Now, while you're waiting, you have one kind of weird but absolutely critical job. You have to try and catch the stone. Yep, you heard that right. Your doctor will give you a little sieve or a filter. And I know it sounds strange, but trust me, this is hands down the most important thing you can do to protect yourself in the future. And that brings us to our final section, preventing the next one, because nobody wants to go through this twice. And the secret to making sure it doesn't happen again? Well, it's all about that little stone you hopefully just caught. And you really, really want to focus on prevention, because for so many people, a kidney stone isn't a one-and-done kind of thing. The numbers are pretty shocking, actually. About half, 50% of people who have one stone will have another one within 8 years. That's basically a coin toss on whether you have to go through all that pain again.
So how do you prevent it? Well, just like with the treatment, a lot of the old advice is being re-examined. What about forcing gallons of water or going on some super strict low oxalate diet? The latest guideline actually says the scientific evidence for those things is pretty weak. It's not that they're bad, just that there's no strong proof they work better than just following general healthy eating advice.
So if all that old advice isn't the magic bullet, then what is? What actually works? Well, it all comes back to that little stone you were asked to catch. The real key to prevention isn't some one-size-fits-all diet plan. It's analysis. And that's really the heart of the matter. That tiny little crystal that caused you so much pain, it's also the key. It holds the secret. By analyzing what your specific stone is made of, your doctor can create a personalized prevention plan that actually works for you. It transforms this horrible random event into powerful information. And that really makes you wonder, doesn't it? What other secrets are our bodies trying to tell us if we just know how to listen?